Diabetes. What is diabetes? Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively uses the insulin it produces. Definition reference WHO. Types of diabetes. Type 1 diabetes, previously known as insulin-dependent, juvenile or childhood onset. Body does not produce enough insulin. Type 2 diabetes, body produce insulin but cannot use it well. Gestational diabetes. It is a temporary condition in pregnancy. The most common type is diabetes type 2. Impaired glucose tolerance and impaired fasting glycemia. Impaired glucose tolerance, IGT, and IFG, are intermediate conditions in the transition between normality and diabetes. People with IGT or IFG are at high risk of progressing to type 2 diabetes, although this is not inevitable. Causes. Type 1 diabetes is thought to be caused by autoimmune reaction which destroys the cells in the pancreas that make insulin, beta cells. Type 2 diabetes is caused by family history, being overweight or obese, low level of physical activity, poor diet, age more than 50, or pathologies like polycystic ovarian syndrome. Gestational diabetes occurs during pregnancy. The symptoms can be mild and may take many years to be noticed. Symptoms of diabetes include feeling very thirsty, needing to urinate more often than usual, blurred vision, feeling tired, losing weight unintentionally. Symptoms of type 2 diabetes can be mild. They may take several years to be noticed. Symptoms may be similar to those of type 1 diabetes, but are often less marked. As a result, the disease may be diagnosed several years after onset, after complications have already arisen. Effects of diabetes. Diabetes can damage blood vessels in the heart, eyes, kidneys and nerves. People with diabetes have a higher risk of health problems including heart attack, stroke, and kidney failure. Diabetes can cause permanent vision loss by damaging blood vessels in the eyes. Many people with diabetes develop problems with their feet from nerve damage and poor blood flow. This can cause foot ulcers and may lead to amputation. Over time, type 2 diabetes can cause serious damage to the body, especially nerves and blood vessels. Prevention. Lifestyle changes are the best way to prevent or delay the onset of type 2 diabetes. To help prevent type 2 diabetes and its complications, people should reach and keep a healthy body weight. Stay physically active with at least 30 minutes of moderate exercise each day. Eat a healthy diet and avoid sugar and saturated fat. Not smoke tobacco. Diagnosis. Early diagnosis can be accomplished through relatively inexpensive testing of blood glucose. Following tests are done: HbA1c test, fasting blood sugar test, glucose tolerance test, random blood sugar test, glucose screening test, glucose tolerance test. Treatment. People with type 1 diabetes need insulin injections for survival. One of the most important ways to treat diabetes is to keep a healthy lifestyle. Some people with type 2 diabetes will need to take medicines to help manage their blood sugar levels. These can include insulin injections or other medicines. Some examples include metformin, sulfonylureas, sodium glucose co-transporters type 2, SGLT2, inhibitors, subcutaneous insulin injections. Along with medicines to lower blood sugar, people with diabetes often need medications to lower their blood pressure and statins to reduce the risk of complications. Additional medical care may be needed to treat the effects of diabetes. Foot care to treat ulcers. Screening and treatment for kidney disease. Eye exams to screen for retinopathy, which causes blindness. Side effects of antidiabetes drugs. GI disturbances, flatulence, loss of appetite, metallic taste in mouth. Hypoglycemia are side effects of metformin. They may also affect liver, and cause ketoacidosis, hypotension and bone diseases aside. Effects of SGLT2 inhibitors. Skin reactions, hunger and weight gain are common side effects of sulfonylureas drugs. Thank you for watching.